introduction, respected dignitaries on the stage and off the stage. It's such an amazing time for us, even as we are excited this evening to launch the Grace Cancer Run, the 7th edition. This morning, somebody sent me a message. I think Padma Garu sent a message. She said a message, "Are you excited?" I hope you're all excited. Honestly, we're all excited and we're all really thrilled that you are part of this amazing global movement that has taken shape from Hyderabad. The cancer awareness drive, which has gone global, through the efforts that we have started humbly, thanks to everybody's support here. Each one of you are a celebrity. Each one of you are, very important, special for us. And without your support, this could not have been done. And I'm grateful to have great friends and comrades with us, especially this evening. I want to mention the support of HYSIA. The president himself is here, Prashant Garu, and of course we have SCSC supported by the Secretary General Ramesh Kaza, and of course Ali Garu always here supporting us. Ajay Mishra ji is part of the family. He is an advisory board member as well, so I don't have to thank him. But one thing that I want to mention here is this kind of a drive is not possible without supporters, for which I think I'm grateful for Compian Developers for being the title sponsor for this year. Please give them a big round of applause. I also don't think that I'm finishing a vote of thanks right now. Actually, I just want to recognize these things are possible only because of like-minded individuals coming together to make this happen. That's why I'm taking a couple of minutes to recognize them. Of course, we also have Anup Rubens here, our dear friend and family. Please, why don't you please stand up? Please give a big round of applause for Anup Rubens, a great supporter for all of us. Of course, most of you, if I take names, I think it will take 1 hour and Minister would have already left this place also, so I'm not taking names now. Rodney, thank you for being powered by, why don't you stand up? Yeah, from Ryan Company. So without much of an ado, I just want to again take you through, for some of you are new here for the first time, so I just want to take you through the journey of Grace Cancer Foundation. So if you see the slides out there, I think the vision is very simple. How do we alleviate the cancer burden in the community? That is the singular vision with which we have started working about 11 years back, as Sujata Rao Garu, our founder chairman, has mentioned. So how do we achieve this vision of alleviating the cancer burden? Through 4 verticals. The mission is very straightforward. One vertical is education, that is awareness drives. This run is part of this drive. The second vertical is early detection. That's what is very core to the foundation in terms of the screening through mobile screening buses. What we do at the rural areas, the unreached areas, the buses go there and screen for non-communicable diseases, may it be diabetes, hypertension, and most common cancers like breast cancer. Mammography is done, the pap smears for cervical cancer, the oral cancer, the lung cancer. The most common cancers are screened at the point of care. For people who do not have access, we go to their doorsteps and do the screening. That is the second pillar. The third pillar is treatment and rehabilitation, what we do. And most of you would know that we have, through the foundation, supported the cancer hospital in Nizamabad, providing state-of-the-art cancer care in the rural communities. And of course, the last option is, the last vertical is research, what we do. And the slide could be pretty busy, but the time has flown very fast and quick with so many, milestones in our journey, with more than about 7 Guinness World Records and Limca record. But more than all these records, I think what gives us satisfaction, what gives us joy is that a single life that we touch and save and bring smile on their lives. I think that's what is very crucial for us. Of course, this year also has been very, very, fruitful for us in that sense. If you look at the impact over the last 11 years, about 1.2 million lives touched across 130 nations with a huge volunteer network. I think you're also part of this wonderful network with which we've been able to touch so many lives. So the number of cases detected, about 10% first time diabetes and hypertension being detected, is huge achievement in that sense, to be able to make people aware of an issue which they didn't know that they had. So that's what has been done in the past 11 years. So even as you see the impact to the cancer hospital at Nizamabad, again, a very kind of a debilitated condition hospital has been totally transformed into a state-of-the-art hospital, providing even including radiotherapy care is being given in the grassroots areas. This hospital actually caters to about 5 districts in North Telangana, the only center having radiation equipment in Northern Telangana. So the team is all there, you all know that. So don't want to go into that. I think needless to mention. So awareness drives at scale, thousands of people gathering for this kind of an awareness drives, including human papilloma virus infection and the cervical cancer prevention. How can we do that through vaccination drive? That has also been taken up across both Telugu states in a big way. So through the mobile buses, again, as I mentioned, the dream is to screen 100,000 people this year. We are at about 55,000 as we speak. By the end of December, we're looking at 100,000 people to be screened through this foundation, through the 6 mobile screening buses that we have, which are fully equipped with all the technology that is required. So we have also standardized a process for screening for NCDs. So that we call it as the GCF way. So a systematic way of screening for these diseases is put up in place so that it is scalable. Anybody can reach out to us and we can replicate this model anywhere in the globe. So even as you see here, research again, we have been able to adopt technology. AI is a big word today. Even as you speak, we are looking at the conference for AI. So we have been able to deploy the technology for screening. We've been able to do telescreening. We've been able to develop a unique software for gathering this data and even do a remote reporting through AI solutions for mammography and X-ray so that patient need not wait, including the pap smears. That's how it's happening. And of course, the big event for which you are all seated here is the upcoming event, the 7th edition. Of course, the race director, Krupakar Reddy Garu, is here. He'll be able to take you through what this race is all about. But just to give a context and the history, this has grown in numbers over the last 7 years. If you see here, it began as a humble effort from about 9,000 people globally to now it has become more than 130,000 participants in the last year. And the dream is that this year we could actually surpass this in terms of reaching much more numbers of people so that we make them aware and we make them take necessary steps to prevent this disease. So that's the intention, that's the purpose with which we are driving. And from the bottom of my heart, let me thank each one of you who are seated here. It does mean that you are actually supporting for this cause. You will take this message of prevention of cancer and awareness for cancer so that together we can beat this disease. And at this point of time, there are many cancer conquerors seated here, and I want you to give a big round of applause for their strength and resilience with which they have fought this disease, and they have given a hope that cancer can be conquered. And as we all know, early detection helps in saving lives, especially through screening and raising awareness so that we can detect cancer early. So once again, thank you so much for all that you do for us, and together we can conquer cancer. Thank you.